Sponsored by the Advanced Cosmetic Surgery and Laser Center.
Welcome back, everybody, and look good on your lunch hour. May is Skin Cancer Awareness Month, and if you have noticed a few changes on your skin, Hope Merz of the Advanced Cosmetic Surgery and Laser Center is joining us. She says you may need to see a healthcare provider to make sure you're not in danger. Good afternoon to you. What do you most often see that maybe puts people in danger?
So, Liz, there's a few different things we see here in our office. One very common lesion is called an actinic keratosis. It's a precancer to non-melanoma type skin cancers, and that's what we're treating today on Denise. But the other thing we see often are moles that may look a little suspicious that could possibly lead to melanoma.
Okay, let me just put up a few of the pictures that you sent to us, because some of these seem obvious, but some of them I might just think like, oh, you know, it's just a pimple or something that was kind of on my face, and I wouldn't even know to look at that, and that can be really alarming, can't it?
Absolutely, that's right. So many times we actually have patients come to us for a cosmetic treatment of a lesion that just won't go away. And they're coming wanting to do a laser treatment or something like that to remove this cosmetically unappealing lesion. But when in actuality, we'll look at it and say, you know what, we might want to take a biopsy of that and send it to the pathology lab and just make sure it's not something that we may need to remove from the skin.
All right, so excellent. Let's pop out of these photos then and have you tell us. You can freeze something, which is a kinder, gentler way to remove that?
Yes, so freezing works well for lesions called actinic keratoses, those first things that we were talking about. And here on Denise, we can see on her right cheek here, she has these little red spots. So what we typically do, and these are so common, everyone watching today is probably like, hey, I might have had one of those. I've had these frozen off myself since my 20s. And so these just come from sun, and you can see I'm just dipping into this liquid nitrogen. This is that similar stuff to what you see come in frozen packages in the mail. This is the liquid version. And what we do is we use this to just spot treat these little red areas. So these are precancers, and they live in the very outside layer of our skin. So we can go ahead and just kill them like that, so they can't go deeper and turn into a squamous cell carcinoma.
Does that hurt?
How does that feel, Denise?
Painless.
Oh, good to know.
She said painless.
Boy, that's a topical treatment that could really save your life. Hope, thank you for just showing us that. We do want to put up your phone number if people have questions, because like you said, I think all of us have seen something like that. You can give Hope a call at 513-351-3223. And just a real quick follow-up, does insurance cover getting those removed if there's a problem, or do we know?
Insurance typically covers if it is a precancerous or malignant lesion. You can also use HSA, flex spending cards. So it's very affordable. Please get in to your provider and let them know if you have a suspicious lesion so it can get treated early and prevent skin cancer.
Yeah, such an important message. Hope Merz, the Advanced Cosmetic Surgery and Laser Center, thanks for joining us today. And we thank our kind model as well.
All right, thank you.